finishing. Here we go. Finishing recruitment means we've enrolled people, people have completed their questionnaires, and we've collected the blood and the urine samples. And so what happens next, most, with the exception of the people that participate this summer, everyone should have received their clinical biomarker results. So that's like the cholesterol measurement, for example. And everyone should have received the perfluorinated chemical measurement. So the new measurement, well, actually not, there's a batch that went out last week, so that the last batch should, if it hasn't been received yet, should come this week. And then the 15 folks that participated from Newburgh this summer, those will take a few more months. We're actually getting ready to ship those to CDC next week for analysis. So those will be wrapped up. The next thing that needs to happen in terms of analysis, actually two things. One is that additional tube of blood we collected in New York State. Actually, Newburgh asked for this to measure metals. Those are at the laboratory and need to be analyzed this winter. And so that will happen this winter, and everyone will get those measurement results. And we're actually measuring 4 metals. I think it's 4. And that would definitely lead, and then and cadmium and a few other measurements that we're able to do. And the individuals who provided that extra tube of blood will get those results. And then the other laboratory analysis that needs to happen is for the people that participated in the early 2016 biomonitoring, as well as in the multi-site study. Most of the people actually, and this was wonderful, consented to have us access your stored sample from 2016. And we're going to send some of that sample to the laboratory to measure the same biomarkers we've measured in the new blood sample we took for the study. And why that is important is that that'll show us changes over time in your cholesterol levels and in thyroid levels and in immune function levels, so that we can see what the impact is on change over time with the changing PFAS levels. And no other site's able to do that. And so by looking at and I think we have almost 400 samples in that group total between Hoosick Falls and Newburgh, that will actually provide information to scientists. So those laboratory analyses will happen also over the winter and into the spring to get that information. And at the same time, we're working on all the data that were collected on the questionnaires we have to do a lot of formatting to get the data into shape so we can analyze it. So some of the questionnaires had you record information that's actually a word, and we have to change it to a number, so we have to code it, or we have to clean the data. Sometimes we get kind of funny results that are entered in that we have to correct. And then get it ready to analyze, so we're consistent in how we look at age, for example, or we're consistent in how we look at body weight and height. And so we take that. So all of that data should be ready this summer. And then we can finally analyze. This is why science is so very slow. And we can start analyzing the large combined data sets together for using all 5,000 people. And at that point, we'll be reaching out to all of you and updating folks on that progress as we start looking at the various hypotheses. So we want to look at cholesterol, we want to look at thyroid function, and some of the health outcomes that are reported. So that is from the big study part. That's what we'll be working on. In terms of the New York site, we have some activities that are going on now that we very much want to report back to you. So some of you may remember Jordan McAdam. She was my doctoral student who summarized the literature and posted that literature to the website, and she was often on our calls. Part of her dissertation was to look at the biomonitoring data from both Newburgh and Hoosick Falls. And the health department has also done another analysis of the biomonitoring data. We have a couple of different things we're looking at. We're almost done with those analyses and are getting ready to submit them for publication, but we obviously want to present to the communities before we do that and answer questions. So I'm hoping within the next couple of months, we'll be ready to present that information and provide feedback and gather information. And then actually the feedback from community members will also help us then in planning out the next level of analyses that we can do with the health study data. And so that's why that step is important. And so we'll be getting ready to do that. So one of the questions I had for all of you tonight is, we're kind of going into this strange time period between now and summer where, unlike the recruitment period, I don't have regular updates on numbers. It takes a little while to get the analysis out. We know we're going to want to do a question and answer period and a presentation to you sometime late fall, early winter on the biomonitoring results. But then we kind of go into this quiet period, and I'm curious what would be helpful for all of you, or how can we be helpful for the community? When I pose this to Who's It Falls, one of the things we talked about is having me come down on on a few occasions and over to Who's It Falls and give them an update on what the science is showing in the broader community. So not necessarily what we're unless it's ready seen in the study, but what is being published, because other people are also looking at PFAS on a regular basis. But also, obviously we want to present the biomonitoring results. And one of the other question I had is what's the best mechanism for that? With that. So I'm going to stop for a second and let me just first start with, do you have any questions about the process of what we're working on right now?
So I was I was curious, of the 500 and the 40, how did the numbers break down for Newburgh?
So the 500, it's about even between the two communities for the adults. And the children, I have to go look. I don't know, Gloria, do you remember offhand? Is it about even for the kids, or do we have?
It might be a little bit more in Hoosick, but I think it is about even, yeah.
Yeah, it's not too far off. So it's almost evenly split, which is good. Because I know that's one of the things both communities were worried about going in. But it was pretty even, which is why we wanted to do a little bit more in Newburgh over the summer. So that worked out well.
Did other sites have the same problem, like this huge the ratio of children to parents? Was it a common factor regardless of economic background, whatever?
Yep, all the sites struggled with kids. And that's something we've started to discuss with ATSDR and CDC. A number of us that work in this area regularly have asked for a different study, one that's focused on kids. And I think with the 500 kids, even though that number is well below what we had hoped for, that will give us enough information to go on to be able to design a new study to then a better prospective study for the kids and what to focus on with them. But we all struggled with getting the kids, and we struggled getting that neurobehavioral testing, which is not surprising given the length of time. And so that's something that we are discussing. We were very comparable in our numbers with most of the other sites. There are a number of other sites that are also right around 500. The sites that were greater, Pennsylvania had close to 1,000, as does I think California is closing in, but they'll still be short of 1,000, and Colorado. But the other sites like New York are right around 500.
Yeah, I know Joanne was saying how they were pretty successful in PA. I'd like to see how, because you're asking what you guys can do when coming down. It's funny because it's the kids are the area that is more likely to actually have more data, because they wouldn't have been living 20, 30 years exposed. It'd be more likely they're very young when we're getting our first measurements, and then we could really see how it proceeds.
Pattern. Okay.
I think it's more just for as parents, it's more about the unknown, and there's so much vagueness in it may be linked to and all of that. And that's sort of the end conversation. And I don't know how you could bring out more proactive things that parents can do so at least they feel a little bit empowered, like they're not just beholden to, well, that's the numbers and we'll just be waiting until there's diagnoses down the line. When you have lead poisoning and other things, you up your calcium, you try to reduce the absorption, all of that. I don't know how that can play out with advising parents here.
That's a great suggestion, and there are things that can be done. Certainly some based on that NASM report, in terms of follow up in working with the clinical community, and also just being having a conduit where we can share information so parents know what to look for. This is in to empower them in that way. I can also reach out to, there are two groups. The group out of NC State, with the Superfund Center there is doing a lot of work in communication with their communities. And I can reach out to Jane Hoppin, who's the lead there, and I'm happy to talk to her to brainstorm this idea. The other one is the group out of Silent Spring Institute, and they are a site, and they've developed some tools for community members, and I can talk to them too about helpful tools in the trainings. That's probably more of a formal, I don't necessarily need to use that word, but like what kinds of things we can share with communities, and maybe propose some ideas, and then you can give us feedback on what to do. And then the other one is, I think, to keep pushing on the clinical community too, and providing information from them so that when you are working with your clinicians, they can respond in a way that makes sense.
Yeah, because I think
yeah.
I think the issue is that you can have parents and community members that are very engaged in learning a lot, but when you get into a doctor's office, if they're not really connecting dots,
Yeah.
I mean, I experienced it myself, and later on found out the doctor was somehow referring kids to be tested elsewhere. But so I brought up the health study, and for instance, Nicole's cholesterol levels were high, and it took a lot of push to get her to be like, oh, okay, yeah, we'll look into it. It shouldn't
Yeah,
be, and they should be
yeah,
able to correlate things so that it doesn't have to be blatantly in front of them.
and you should be empowered to do that. So let me, and that is certainly a topic that came up. We talked a lot about on that NASM committee, and how to empower community members and how to encourage clinicians to listen, because the reality is, while they need to be aware, and we make it very clear in that report that if you're working with a child from a community where there's known exposure, then you need to be more alert. But regardless of whether or not they know what their exposure is, the recommendations are this is, if you have a child in front of you with high cholesterol, this is what you need to do. They shouldn't have to be convinced that you have to look at it because if it's high, then this is what you do. And so there are things that we can share, and work with. And we have a couple of clinicians that are very interested in this very topic and how to help with that. So let me do some digging and outreach, and maybe we can come up with some sessions. And then if you want to help us figure out what type of session, like how to invite people, and what would make the most sense, if they want to see me in person, if it's, or a combination of things, if, whatever would work best. I know it's always hard with parents, especially of young ones. So what is the best mechanism? And then again, we always make things bi and trilingual with that. So I very much like this idea on how can we work together so that the community members and the parents are empowered. It's very intimidating going into a clinical office, especially if they're not ready to listen with that. So I can definitely explore that, and we can communicate on that. Do you have a sense, is this something like on a school night through the school district that they might want to hear? Or I know you've meeting with the school district hasn't always been helpful, or is there other organizations, or do you think through Newburgh Clean Water, or what do you think?
I mean, it's not going to be one session, unfortunately.
Yeah.
There's
That's
no
okay.
miracle date and time, unfortunately. And
Yeah.
I think how you expressed earlier, I think everyone is just in this weird, I don't know if it's the moon phases, the planets or what, but we're all in a
Time.
fog. But I also think it has to do with what audiences, it would be really great to do some sort of professional medical forum, but God bless that, I don't know how many would be willing. Um, and then if it's parents and families, it's, we have third shift families here, so it all depends. I don't know if you collected data on that for those who actually came for the testing, like to know, were they working a traditional 9 to 5? Were they?
That's a great question. I don't recall that we have that for the MSS study, but I have some. So my other study, we collected we measured PFAS in the newborn blood spots, and we collected a little bit of the work history. I'm trying to think, it's been a little bit, and I can go look. But then there's another study called the ECHO cohort study, and that's actually a consortium of all of the cohort studies that are being done with children in the United States, and they're working together and merging data. And they might have some of that data. I know, in part because we've had these discussions in that consortium on talking about sleep patterns. And we collected some additional occupational data on that. So I can reach out to some colleagues who might be looking at that because they've also measured PFAS in that study. But
Yeah,
I think
I
that's
was thinking more like
interesting.
availability, like was there a trend?
Yeah. Oh, yeah.
It
To
tended
when
to
to
be
communicate.
traditional 9 to 5ers who came for the study on a Saturday, or was it, you know, I don't know.
We didn't, you're right, we didn't ask that question, but I think what it is, it's like everything else we do, we have a multi-pronged approach, right? And a
Mhm.
couple different options, and then also maybe some handouts, and it could be a mix of things where, and not everyone wants to go to a meeting, they want to read something or look something up when they need it, and then be able to reach out with questions. And then others want a presentation with Q&A, and we can propose a mix of things. So I can work with Gloria and our staff, and we can maybe put a little plan together and kind of and distribute that and get your comments on it, and see how that's work. We can also record some videos and have those posted up. So there we have a little, some different options, and I can also reach out to Silent Spring. They've done a fair amount of work in this area as well in terms of communication and sharing results and reporting back to families. So we can put some thoughts together and share that.
I wonder if it's something that we could ask people who've already participated, like if we sent out
Yeah.
like a notice, like, hey, we want to present information, when's a convenient time for you? Just anecdotally, Jennifer, we did notice that there were a lot of third shifters, like people would come to the appointments directly after work at like 9 a.m. So we did notice that. But it wasn't a question that was formally a part of the questionnaire, as far as like their shift time. But we could maybe send out a survey, like what time works best for everybody for us to do a presentation or something if we
We
wanted
could
to do
do
that.
that because we do want to send out, digital newsletters for those. And again, we could do a quick survey that's quick over the phone that doesn't cost anything. For anybody to participate, it's 1 or 2 questions that they can click on even from a phone. And see, that's a good idea, Gloria. So, okay, these are all good ideas. We can move forward with that.
And it might be nice to go in a positive, like maybe a wellness
Yeah.
event where there's other avenue, nutrition and other things. I know the county and the state have, offices that deal with that. We have different groups here. Maybe that way it's a little bit more positive, and maybe you could put together a booth where it's not really as formal, not a kissing booth, but like, people can come and just chat with you, chat with a doctor, chat with
Yeah.
a health professional,
Okay.
bring your results or whatever. And that way they don't feel so much having to commit to, I'm going to be there for 2 hours at a,
Yeah.
session. And yeah.
Absolutely. I like that. And I like talking to a health professional and or having a pediatrician there. That's a super idea. Okay. Any other ideas? Thoughts? So related to the kids, one activity that's going on now, invitations are being mailed out in Newburgh and Hoosick Falls to parents who may have given birth in Newburgh between 1998 and 2018, and asking for permission to access the newborn blood spot that's stored. And so these are the 5 drops of blood that are taken from every newborn before they are sent home from the hospital. And again, we developed the ability to measure, in this case, 4 perfluorinated chemicals in the saved spot, but we can't access it without permission. And so being able to access it and being able to measure the perfluorinated chemicals, and then we do have a questionnaire that can either be done over the phone or can be done on the computer, to help us understand what are the factors that contribute to exposure in a newborn, because they're getting those exposures in utero. And also to help us to better plan out studies and understand exposure assessment for women in particular, because the half-life for women varies because of their pregnancy history. And so this will provide information for that. So that's an ongoing activity that has just started. We just started mailing out those invitations. So we'll have that information on the website, and people may comment on it. There's no new blood draw. It's all saved. And again, just because I know this question comes up, no one can access those samples without express consent from the parent. And we want to go back that far because we're hoping to look at changes in exposure over time with that. And so it's a new piece. You don't have to have participated in the MSS to do this new piece. And so that might be appealing to those who maybe didn't participate but are still interested in that. And if folks are interested or have questions, we have information. We have a flyer we can send for folks to hand out as well, and provided at the upcoming RAB meeting. We'll have folks there, and at various other events. And I think that's all I had. There's DOH is about to get ready for the next round of the biomonitoring sample in Newburgh, and they're also doing another round in Hoosick Falls coming up. And again, this is, an opportunity for people who perhaps didn't participate or couldn't participate in the study. So staff at Newburgh Central School District, for example, that might be interested. But is there someone from DOH that can speak to kind of the timing of that?
I think Steve might not be able to respond. Yeah. Oh, go ahead.
Oh, there he is. Okay.
Yeah, so if you go to our website under our Newburgh blood testing page, the questionnaire is already live. It's a brief enrollment questionnaire. Who wants information about, obviously your address and name and age and stuff, and a couple other very brief questions, and then we would send you a test order just like we did in the first round of biomonitoring in Newburgh. So that's already live, and anybody can participate who wants to. Probably within the next 2 to 3 weeks, we'll also be sending out invitation letters to anybody who participated in our first round of biomonitoring. These are both Newburgh city residents as well as residents of the surrounding town, or people who worked in Newburgh, or people went to school in Newburgh, or perhaps former residents who no longer live there. So, we're not really restricting eligibility in any sense. So anybody who wants to participate is welcome to.
Firefighters would be another group because they couldn't participate in the study, but might be interested in their levels with that. Any questions? All right. I think that's all I had. Gloria, did I have anything else on my list?
No, I think we covered everything.
Yeah. That you should know the PIs are all, I'm very pleased and that we're all very much on the same page, and that really our main focus right now is making sure the communities are updated regularly and have a good handle on the results we see once we start analyzing them statistically. So we're pushing ATSDR pretty hard to get us the data as quickly as possible so we can start getting the analyses done and communicate with our community. So we have ongoing discussions. I actually saw another flurry of emails this evening before I got on to get that information out. I may be reaching out with we're outlining some talking points for those who might be interested to share with your elected officials on this. And once I get that together, and based on the emails tonight, I think that's in the next couple days. So I'll reach out to both CAPS again with that information that you can share, and I'm happy to answer more questions about that with all of you, and also to participate in any discussions. But we thought it important to get some talking points together for the communities to have for that. That's all I have. Any other questions, thoughts, ideas?
Yeah, and I just wanted to add Jennifer and Gabrielle and Jeannie. The meeting's being recorded. I know there was some folks last minute who couldn't make it, and I told them we would record this session and get it to them. But feel free to reach out to me anytime with any ideas that come to you, and we'll be happy to think them over and work with you all on any ideas you might have.
Okay, thank you.
Thank
All
you.
right. Thank you. It's going to be a rainy weekend, so everyone stay dry. And you know how to get a hold of us. And I think we do have some folks coming down for the RAB meeting in a couple weeks, and we'll have people there with information. But obviously, always feel free to email or give a call.
Will you be there for the poster boarding session at 5, or it's just the RAB meeting?
Yeah, I don't. Oh, did June get June? What?
Yep. 2 staff from DOH will be there for the poster meeting and for the main meeting.
Okay, great.
Yep.
Thank you.
All right. Okay. Well, thank you all. And again, feel free to reach out if you have additional thoughts or questions.
Thanks so much. Have a good
All
night.
right. Thank you. Bye-bye.
Have a good night.
Thank you. Have a good night.
Thank
Bye.
Bye.